Welcome to today's press briefing. We have with us from the Center for Health Protection, Head of the Communicable Disease Branch, Dr. Chang Shuk-kwan, and from the Hospital Authority, Chief Manager Dr. Larry Lee. We'll first hear from Dr. Chang. Good afternoon. Yesterday we've had 735 PCR positive tests and 698 RAT positive test results. So we have altogether 1,433 positive results. In terms of PCR cases, there are 633 of them that are reported using the online platform. So over the days from the 8th to the 10th, so altogether there are 3,128 cases that are actually RAT positive cases, not PCR, RAT. So we have altogether positive cases including PCR and RAT tests at this moment. Since the fifth wave is 1,180,392, including over 700,000 PCR cases and 440,468 RAT cases. Of the 738 PCR tests, 168 of them are picked up by Hospital Authority. 149 cases were confirmed by Public Health Laboratory Service, and 373 cases were confirmed by private laboratories. Of the 448 cases, we have conducted genome sequencing. So far, we have not found any samples with a L452R variant. 443 cases are negative to L452R. That is, they are suspected Omicron cases. There are 5 cases that are pending or with an insufficient viral load. There are 13 imported cases to date. 10 of them are arriving on the 11th of April. And 100 arriving on EK582, and there are some arriving on CX452 and also TG680. In terms of residential care home cases, we have not received any new cases reported. Well, of those care homes that have seen infection cases, there are 29 care homes for the elderly and 7 care homes for disabled, reporting that there are 54 residents and 9 staff members that have been infected. Of fatal cases, we have received another 59 reported cases. They are from the Hospital Authority. So far from the HA in the 5th wave, there are 8,618 death cases. They are cases with a positive result. Together with other reported cases, there are 8,673 cases. 3,544 of them are females and 5,126 cases of them are males. And the analysis are similar to previous ones. The age range is 11 months to 120 years old, median age 86. So a similar pattern of the different age groups. That's all for my report. We'll now hear from Dr. Lee. Good afternoon. So far we have 9,222 patients staying at different public hospitals at the community treatment facilities as AWE, the North Lantau Hong Kong Infection Control Center, and the Infectious Disease Center of the HA. Yesterday, we received 5 critical cases. They are 2 males and 3 females aged between 63 and 89. 3 of them have not been vaccinated. 1 has received 1 dose and 1 received 3 doses. There are 16 of them that are in a serious case and 58 critical patients staying in ICU. As at midnight in the previous 24 hours, there are 52 patients with COVID positive results that have passed away. They are 29 males and 23 females aged between 47 and 56. Of these cases, 29 of them are from care homes. and 29 of them have got no vaccination record. 15 have 1 dose, and 8 have received 2 doses. 48 of them are above the age of 65. There are 2 that are younger cases. I would like to elaborate on them. A 47-year-old female with chronic illnesses, not vaccinated. She suffered from terminal cancer. The cancer cells have spread to different places, including the brain. On the 19th of March, she was sent to Tuen Mun Hospital A&E department, suffering from convulsion. The day before, she found that her RAT test was positive. And in the deep throat saliva test, the result was also positive. She was admitted. Her condition changes, and we have prescribed antibodies, steroid, as well as medications to control the convulsion. And on the 21st of March, the test was negative. However, her condition continued to deteriorate. On the 11th of April, at about 5 a.m., she passed away. The other one is a 51 female also suffering from chronic illnesses. No vaccination record. She stays at a care home. She suffered from mental illnesses and also some blood problems as a deficiency of platelets. And on the 1st of April, she went to a designated clinic because of a RAT positive result. At that time, she suffered from cough, shortness of breath, and also lethargy. At that time, her blood oxygen level was rather low, and at the designated clinic, she was given oxygen supply, and then she was sent to United Christian Hospital A&E department. That was around midday. Her shortness of breath deteriorated. X-ray showed that there was pneumonia. She was admitted. On the 2nd of April, that is the second day, she was intubated. Subsequently, her condition continued to deteriorate. At about 7 a.m. on the 11th of April, she passed away. Because of time lag, there were 10 deaths. On the 10th of April, they're all female, aged between 85 and 98. And in the past day, 1,430 patients discharged and recovered. There are also 7 patients that were positive when admitted, and 7 patients were close contacts. So far, 2,160. Over 21,600 staff members have been infected, and a lot of them have resumed work. And I would like to make an announcement in relation to compassionate visits. Recently, there has been an increase in a number of patients suffering from COVID-19 that are in hospice. So we would like to make arrangements for families to visit them. Experts have looked at the relevant arrangements, and they've decided that wherever possible in public hospitals, we will take into account the wish of family members before arranging visits. And those who would like to visit will need to provide a negative RAT test result done in the previous 24 hours. If that cannot be done, then an RAT test will be arranged just before the visit, and it should be negative. Those who would make the visit would need to read the details of points to note, and also need to clean their hands thoroughly, donning suitable PPE, and after the visit be put under medical surveillance 7 days. And at the time of the visit, they would need to scan a QR code of under the Leave Home Safe app. The hospital authority have also made arrangements for those who have recovered within 3 months before the visit. Those who would like to make the visit will need to provide infection and recovery proof to relevant staff members. There are limitations in relation to our visitation arrangement, but wherever possible, for patients who are in a critical condition or who are in hospice, we will arrange for compassionate visit. And for other patients, we'll arrange for online visits.
For submit questions, please raise your hand and then wait for the microphone. When you get the microphone, please introduce yourself. The one at the back, the lady. Good afternoon, I'm from TVB. This morning, concerning the cheating in vaccination, the student nurse, has she received any training? And is there any restriction for student nurses administering vaccination? And also there was the use of, that the company has had the problem of using outdated vaccine. Was there any penalty? Concerning the comprehensive tests, how many have reported? Yesterday, it was announced that doctors in private practice can apply for oral for the antivirals. How many applications have been received? Will you adjust the number of the designated clinics? Well, as far as I know, our colleagues of the Department of Health have been informed, and they are now conducting investigation. I do not have further details. As for reporting of the antigen test results, from the 8th to the 10th, we received 3,128 positive reports. On the first day, 1,696 cases. Second day, 774 cases. And third day, 658 reports. There may be some smaller number of cases which will be reported today in relation to the 10th of April. So tomorrow, the number may be bigger in respect of the 10th of April reports. We've seen that there was a sudden increase in the declining trend, maybe about half of 1,000 or so people in responding to the universal tests have reported. Concerning these few hundred cases, we think that they are asymptomatic. As for the comparison between symptomatic and asymptomatic ratio, it has been confirmed, and the identifying of these hundreds of cases will help to reduce the spread in the community. As for the application by private practitioners on the internet, the platform is in operation. Some private practitioners are applying. As for designated clinics, well, there is nothing special. As for private practitioners prescribing antivirals, they have to comply with the rules of the HA, and we have made arrangements with them. The one in the middle. I'm from Cable. Concerning private practitioners can apply through an internet platform for permission to provide antivirals. What is the supervision arrangement? And how can you make sure that they don't charge the patients? Doctors are not allowed to charge additional fees from the patients. But if the clinic use a kind of extras as an excuse because of using the antiviral, administering the antivirals, they want to add a surcharge. Is that allowed? Can that be a gray area? A man has been admitted in North Point, a quarantine hotel. He passed away. What are the details of death? Did he have any clinical record? As for LAT for students before they go to school, and parents worried that their children don't want to conduct LAT. So is there any way you can use other means? Are there other means to deal with that? Say, for example, putting some kind of a swab test. Can the test be done before, the night before? And also those who have vaccination or no vaccination have to undergo the LAT. So can you allow the schools to take the students to take tests on alternate days, or just once a few days? As for private practitioners, they should not charge on the antiviral. The practitioners of private practitioners have other fees and charges, and that is not related to that. As for the designated hotel, I don't have information about that. If RAT is to be done, it is on the same day before school, and they have to get up earlier to conduct the test. This RAT is the issue, and there is no difference between those who have vaccination or who haven't. The chance of getting positive tests is similar. Vaccination helps to reduce serious cases and reduce death. You've heard about Dr. Kwan and also other pediatricians who warned against COVID, children giving COVID getting serious problems. So we encourage children to get vaccinated. This is to help preventing serious and even serious cases of deaths. That is not one shouldn't just consider RAT. Whether you have a jab or not, you can still be infected. If you have RAT positive, then you better not go to school so that you don't spread the illness at school. The gentleman at the back. I have two questions. Concerning the confirmed cases, more than 1,000. How soon will the number decline to less than 1,000? Will you consider contact tracing? When will you do that? And if you don't do that, why? We have seen that universal rapid tests have identified some people asymptomatic. So will you provide more incentive to encourage people to report the test results? I believe you have the testing kits given out by the government. I hope you will make full use of that. If you go to high-risk places, if you have friends or family members who are confirmed COVID patients, if you're worried about them and you have symptoms, then you better conduct a test. I know that there are many testing kits available in the market, and the price have gone down very much. As for contact tracing, we need to have enough capacity to trace all the contacts. We also need to have adequate isolation facilities and also speedily isolate them and conduct tests. We need to wait for the number to reduce to a very low level before we can do it thoroughly and adequately. If we look at the previous 4 waves, the maximum, the highest number was over 100. At that time, we had we found it quite difficult to do the contact tracing already. If you want to do contact tracing thoroughly, if you want to identify all the close contacts and also family members of close contacts and send them to quarantine centers, you need to have the facilities available. Next, the one in the front. I'm from HKO1. Concerning RAT for students. Do they have to do RAT every day, and how long should they do that? For how long should they do that? And when will you allow them to, say, reduce the number to twice a week? As for the care homes, there are new cases in homes that have been infected. Is it related to in situ quarantine? HA, CHP, and the Social Welfare Department, will you work together to send some of the confirmed elderly cases to the holding centers? Well, we have to wait after the school is open before we can improve the arrangements. As for Omicron, the incubation period is very short, just 2 or 3 days. If you do the test intermittently, that may not be, or just once a few days, and the students may bring the virus to school, causing an outbreak at school. And there will be the need for more emergency measures.
At care homes for the elderly, the infected cases has dropped in number. So we will try to evacuate elderly people who've been infected to holding centers, but we don't have the number with me. Sorry, the speaker's off mic. For the majority of them, there is no institute isolation, but as to whether there were some previous cases and some transmission from these previous cases, might be there was still some kind of isolation, because a lot of the cases of Omicron are asymptomatic. I'm from Hong Kong Economic Times. I'd like to ask about rapid tests. Of the 3,000 or so cases, how many of them in percentage are asymptomatic? How many percent of the cases are under home isolation? Any plan to do a comprehensive universal tests? And in relation to prescription of drugs, what is the prescription guideline from HA? At private clinics, can consultation face-to-face mode be done, or does it have to be done on the remote approach? And how many private clinics have used the e-health system? The chief executive said that the morning press conference will be dispensed with when the number of cases drop to 3 digits. Will it be the same for the 430 cases? And do you have information about number of deaths? Just now you asked about RAT tests. What was your first question? What about RAT tests? RATs. 3,000 cases or so. We have about 64.3% of them are asymptomatic. 35.7% of them are symptomatic cases. So that's the figure for the cases reported over the 3 days. We're aware that over 8% of the cases are not high risk. So they have the suitable environment at home or in relation to their health to be put under home isolation. In relation to medication, just now I mentioned that in relation to private doctors prescribing the drugs, they will have to follow the treatment guideline of the HA. I'm not going to go into details because previously we have already covered the treatment guidelines of the 2 types of drugs, because there are limitations. Each time they can request for no more than 10 standard courses of the antiviral drugs. Once a request is made, the suppliers will dispatch the order to the address of the private clinic. In relation to consultation, we don't have a strong view, but we believe that virtual consultation would be in place. In relation to our daily press conference, we have heard you and we will take that into consideration. Now we'll take an English question.
From the South China Morning Post. So for the 3-day RAT testing scheme, so how did the health authority verify those cases? And you said previously that you found more than 3,000 cases in those 3 days, but you estimated that only 800 of them did it for the program. So why is there such a difference? And how do you analyze the program? So is the sample size big enough to provide a snapshot of the outbreak right now, as the chief executive suggested earlier? And were you satisfied with the outcome, about 3,000 people submitting? And also, can I follow up on the private doctor's application for the oral pills? So how many private doctors have so far applied for the medication? Thank you.
So far, in the 3 days from 8th to 10th of April, we recorded 3,128 positive cases reported through the rapid antigen test platform. So before the program, we have been recording a downward trend of number of cases reported through both the PCR as well as the RAT platform. So we assume that, in the recent few days, the number of PCR reported is similar to the number of our rapid test antigen reported. So, but on the 8th, we received 1,696, 1,696 positive cases were detected through the rapid antigen test, and we estimate at least half of these cases were additional reporting through those who were asymptomatic and who participate in the rapid test antigen program because of the encouragement from the government. So without this, the public is they are reporting. When they have a positive result all the time. So so at least I think there are half of the cases detected for those who tested positive on 8th of April were detected additional cases through this program, because the number on that day did not follow the usual trend. And I think we have successfully detected these cases through the program. And we also, I understand the point preference study from the University of Hong Kong, the percentage is also decreasing in recent few days. It's around 0.2%. So, so this also correlates with our decreasing trend, the finding. And I do not have the exact number of the private doctor who ordered through the electronic platform, but I understand they are doing it now and there's ongoing.
下一位，嗰位女士嗰邊嗰位。
The lady over there. I'm from Ming Pao. I'd like to ask, just now you mentioned about 600 or so RAT with samples taken on the 10th of April. That means there are only a dozen RAT positive cases on the 11th of April. And what about the ratio of asymptomatic and symptomatic cases recorded on the 11th of April? Does it mean that members of the public do not do RAT tests after the 3 days? Are there any follow-up measures aiming to identify asymptomatic cases? Second question is in relation to private doctors' requests for oral medication. When a patient seeks consultation, does the patient have to produce an isolation order? If the case is not reported or not a case in your recorded system, how will it be dealt with? When a private doctor deals with each case, does the doctor have to report the case to the hospital authority? Will you check whether the patient is someone on your database in relation to compassionate visits? For visitors, do they need to use the vaccine pass?
嗱，咁我
We received 633 cases reported through the platform. 234 of them took sample on the 10th of April, 19th on the 9th of April, 380 sample taken on the 11th of April. They can report the cases within 1 or 2 days. The 11th of April was not included in the previous 3 days, therefore they have not been analyzed. I didn't specifically analyze 380 cases on the 11th, whether there were more symptomatic patients. But if you look at the numbers of the 3 days from 8th to 10th, I said that it was 70%, and now today it was 65%. So more people with symptoms reported recently. But the ratio is small because the total number is 3,000 odd. So the situation has resumed. As for private practitioners obtaining antivirals via the platform, a patient PCR positive will have a report or an SMS, and that is adequate evidence that it is a positive case in terms of the patient. If the test is from a private lab, then the case will go into our system, and we are aware that this is a positive case. The doctor, therefore, doesn't need to report a positive case because the lab does report it and put it in our system. If it is a RAT result, then the patient should report through our platform. This is not done by the doctor, the private practitioner, but by the patient himself or herself. The patient has to put in personal information, whether he or she is high risk or whether he or she should be quarantined. And if the doctor knows that the patient has not reported that, then the doctor will have to tell the patient to report. And the HA also has to be informed, and the quarantine arrangement has to be made. As for critical patients, the visits on critical patients, they have to use Leave Home Safe, they have used the vaccine pass. We know that the family members are anxious. We do not require a vaccine pass. They need to use Leave Home Safe. Yes, I'm from AM 730. Concerning the variant, apart from BA.1 and BA.2, have you received other variants information? Recently, WHO listed BA.4 and BA.5. As for antivirals by private practitioners, how you set the cap at 10 standard courses? Does it depend on the number of patients? Would that lead to a delay if you impose such a limit? As a reporting is the responsibility of the patient. If the doctor knows that the patient has not reported his or her case, then can the doctor still administer the drug? Are there any control measures you would like to advise the private clinics in terms of, say, the use of waiting room arrangement? Concerning the 13 imported cases, where do they come from, and what is the overall death rate? And concerning school resumption, students have to conduct tests in the morning before school. As for CTN, those below 8 can adopt other methods. And now, using the swab test, can there be any replacement? Is it suitable to have a swab test on those below 6-year-old? We have not heard from our lab that we have new variants, such as BA.4, BA.5 identified. I will check with them on the latest situation, whether they have found anything new. As for getting 10 courses of treatment, that is for the beginning. We will watch the usage rate and whether the administration of such drugs is appropriate. Overall death rate is 0.73%. Imported cases, the 10 cases, EK384, 5 came from Thailand, 1 from USA, 1 from UAE. As for the 2 other cases, CX252, 1 from UK, the other from Spain. Antigen test is a rapid test. You know the result very soon. If you take other tests, say fecal test or saliva test, that takes a longer time. We want to know the result soon, as soon as possible, so that a possibly infected students will go to school and go to school. I have to check the system. I do not know the details. As I said earlier, as for PCR test result, it should be in our system. If it is RAT, then the patient should report the case to us. This is the end of the press conference. Thank you very much. Sorry, speaker is not coming through. The speaker is not coming through. And you mean the person should be a confirmed case, but the person doesn't know that. We know that Omicron infection can be asymptomatic. So we hope that everybody does a test at the same time so that we can identify the asymptomatic cases. For those who have not done any tests in the past few days, well, in fact, they've got the test kits, so I advise them to do the tests. Sorry, speaker is not coming through.
I think all the pointers in the community, the surveillance indicators indicate there's a lower rate of infection at the present moment, both from the point preference study from the Hong Kong U as well as from the sewage study, together with our PCR detection. Yeah.
多謝大家。